Hey guys, welcome back to my channel. So what we'll be doing now is finally the final installment, so number 6 of my Psych series. So if that's something that you're interested in, keep on watching. What's up YouTube? Welcome back to my channel. If you're new here, I'm Victoria. Welcome. And today for our final installment, I have Miss Lynette Ohiku. Okay, she is our nurse practitioner here, and the final installment will be about mental health services, but more so medication and medication management. So without further ado, we're going to bring it out to her.
Well, thanks. So I prepared a number of discussion points, things that I wanted to, just very general takeaways that, that I just kind of wish everybody knew. And to me, it seems so common sense and like common knowledge, but really it isn't for non-medical people. So first thing, when it comes to mental health, I want to address that there is still a mental health stigma, and I hate that, and I'm hopeful that it will change, and I have noticed it's becoming less stigmatized, but I still think, it's still out there. And treatment is not a weakness. It's not a fallacy of character. It's not a fallacy of personal integrity. It is actually a sign of courage, strength, awareness, and a desire to get better and do better. And so you really should be applauded for seeking out treatment. Now, when it comes to medications and mental health, something that, it should be in like big bold letters and like almost stamped on my forehead, I think, is medications cannot fix everything. I don't have a magic wand. Your doctor doesn't have a magic wand. We can't just like sprinkle you with some magic fairy dust. There's no pill that's going to fix relationship problems, or, a shitty spouse, or if your kid's being an asshole, or there's nothing that's going to fix that. There's no medication to fix that. That's something that's a relationship issue. You have to work on that. It's work, hard work, and therapy. And so when it comes to mental health and getting better, the fact is, not only mild, moderate, but severe illnesses require therapy, and therapy really is first line treatment, because all the research, all the study, all the data that we have right now proves that most mild to moderate illness, you don't need meds. Usually you can get better with good therapy. Now, that's not the case for everybody, right? I mean, there are chemical imbalances and you may require some meds, but therapy should be the first line, not a last resort. Meds should be last resort. Something else that I made note of here, because I get asked about it pretty frequently, herbal supplements, including medical marijuana. Natural does not equal safe. I think a lot of times people kind of confuse those two terms, and well, it's natural and it grows in the ground and it so it must be safe. No. Anything strong enough to create a positive impact, help with anxiety, help with sleep, lower your blood pressure, lower your cholesterol, lower your blood sugar, anything that can have a positive impact is also strong enough to be dangerous and carry risks. So natural does not equal safe. I mean, think about it. Heroin comes from a poppy plant that grows in the ground. Do you think that heroin's safe? Right. So natural does not equal safe. Do your research. When it comes to medical marijuana, that's kind of a hot topic in mental health. I'd say probably at least on a daily basis, I have somebody ask me about medical marijuana. How do I get it? What do we use it for? Do we use it here in this practice? And, I always encourage people, you are your best advocate. You need to do your research, really be well informed of not only the uses, safety of a medication, side effects, risks of it. And ultimately, the research out there does not indicate that marijuana actually helps with any mental health diagnosis. Now, granted, until recently, it was a class 1 illegal substance, so there's not a lot of research to go on because you can't research on illegal substances, right? So that is a barrier, and I think as more research is done, that may change. But right now, there just isn't enough research for, me as a mental health professional and the other mental health professionals that I know personally to advocate or to feel comfortable saying, yes, go for it. And when it comes to treating mental health, another key point is that we don't treat diagnoses. We treat symptoms. Regardless of whether you're coming in for depression, you're coming in for bipolar disorder, schizophrenia, whatever the diagnosis is, it makes no difference. It makes no difference. It's how are you feeling, what symptoms are you presenting with, and how can we fix that using medications. And the reason why I point that out is because the medication classes, it's just a way for us to keep track of medications that chemically are similar. But I have people on antipsychotic medications. Are they psychotic? No. Are they schizophrenic? No. So just because you see that label, antipsychotic, don't immediately jump on, oh, they're schizophrenic or they're, a crazy person. I've had patients say, oh, I don't want to take that. That's for crazy people. And, well, no, it's for symptoms. So, just keep that in mind. We're treating your symptoms. And I think that's really about it. I think I covered everything that I had on my agenda. Do you think I missed anything, or is there anything you would like me to address specifically?
Let us think.
Let us think.
Yeah, let us think. Because you covered the drug classes pretty much and how different medications would work. No, I think that's pretty much the overall gist of it. So now whenever it comes to medications, doesn't mean that you can't do your research on it, but don't be like Dr. Google and say, oh, well, I read about this medication and this will be this for my symptoms. Because we offer GeneSight. Okay, so GeneSight is basically genetic testing to kind of see if you have certain types of phenotypes, genotypes. So basically all the genetic shit that helps us identify if you break down medication too fast or if something causes a medication not to work as well. Okay, this is why, my friend had a good reaction to Zoloft, but I reacted horribly. Well, it's not made for everybody. That's why there are different types of medications. So you are allowed to research it, like I said, bring it up to your doc's attention. That's fine. Okay, but if you want
leave the medical advice to the medical professionals.
Yeah, that one,
please.
Yeah. And our guy in training. So, okay. But I'd like to thank Lynette and thank you all for your support and kind words and such. This concludes our final installment for our Psych series. But yeah, as usual, especially with the time of COVID. Lord bless us, but
pray to the COVID gods. Pray to the COVID gods so they don't smite you, right? I know.
Stay safe, wear your mask, stay clean, and have a good time. Have a good time. All right, bye.